Good afternoon, everyone. Thank you so much for the warm welcome, the wonderful food, and the opportunity to be here in Goa and interact with all of you. I know you've all been looking forward for this presentation on the lines of the theme of the seminar, which is innovation in counseling and therapies, and also integration of the different modes of interventions and therapy. And today's presentation, I will try and focus on these aspects, the application and the integration of animal-assisted intervention and counseling and other therapies. This is Goldie. She's a beautiful golden. She was a beautiful golden retriever. And if I tell you that she was my pet, I would get definitely some awes and, like, how lovely from the audience. But if I tell you that she was my co-therapist for almost 8 years, what would your reaction be? So Goldie was one of the very first trained therapy dogs that I worked with in Mumbai and Pune. And currently I'm working not just with dogs, but also with cats in therapy. I'll be introducing my therapy cat my partners as well. But the first question that I often get asked is, how did I get into this field? Like, was it just by chance, or was it something that I always intended upon doing? So my background is in clinical psychology. I have a master's in clinical from SNDT University, Mumbai. And though I was pursuing that academically, my interest was in animal behavior. And I always knew that I wanted to work with animals in some or the other form. And back then, there were limited options, like to be a veterinarian or to be a dog trainer. And back then, dog trainer, behaviorist, even that field was not known. So I was still pursuing canine behavior as my personal interest. And I got an opportunity to train a dog for the school, for one of the schools in Thane, where I'm originally from. And that school happened to be a school for mentally challenged children set up by the Thane Municipal Corporation. So the kind of children that came there, or they were from the group of society where they didn't have accessibility to therapies, or even the parents were not aware of what exactly is wrong with their child. Or this school was run by the TMC, so they had all the services given to these children for free. But the school and the principal at that point of time, Mrs. Shamashri Bhosle, had the vision that a dog would do wonders to the school. And she had this idea in mind that we need a dog for the school. What would the dog do there? How will we, incorporate it in the school work? That was all, vague, because back then there had been a couple of documentaries. This was before Netflix and before YouTube boom. So she had a basic understanding of what service dogs were based on the documentaries that were seen. But these were children with intellectual impairment and associated disabilities. And service dog wasn't really the answer that I knew when I went and saw the school. So I was like, what else can be done? What do these children need? They are already getting therapies. They are getting all the support from the government and the school. What these children need is the acceptance for who they are. And that is something that the dog can give, which the other infrastructure cannot give. And that's how I started researching more on this subject. And that's when I found out that animal-assisted intervention as a field did exist. And I was from the right background of being a psychologist, as well as with my knowledge of animal behavior and training. I could combine these two and actually do something. So clinically trained for first finding research and what is the data that is already happened here, I started finding out what was done before me in India. And I was surprised to find that there was no documented work or no research, no evidence of how this benefited people, or in what areas can it be implemented, how to train a therapy dog. All of this was not there, not existential in India. And that's when I got in touch with my mentor, Dr. Cynthia Chandler, who is a professor of counseling in University of North Texas. And she guided me on how I can work in this field. And my earlier mentor from India was Dr. Shubha Thate, who guided me on how to document what I was doing. And that I worked at Jiddu school for 3 years. Me and Kuti, the first therapy dog, we worked together for 10 years. And out of that, the 3 years was when I collected data based on my work with Kuti. And that went on to be the first documented research in India. So that is how the journey started. But if we go back to what made me do this, it was to visibly see what I couldn't do and what therapy dog Kuti could do with these children. And with that intention, I started Animal Angels Foundation, which is a non-profit organization where we network with pet parents and we assess and train their pets to be therapy dogs. And these therapy dogs, along with our team of psychologists or counselors, will visit different places and reach out to those people or that section of society who may not have access to mental health or good dogs or both together. So that's what Animal Angels Foundation does. And besides that, I have Animal Angels Therapy Center, which is my center in Pune, through which I do a lot of activities under animal-assisted intervention. We all know about Sigmund Freud, but did you know that he had a dog? No surprises there. A therapist will always need a therapist. So Jofi, his Chow Chow, the breed is Chow Chow. He was not really a therapy dog, but he was Dr. Freud's companion dog, along with many other dogs that he and his wife had. But Jofi particularly assisted him in his office. Not assisted, he was like the companion in his office setup, and they had a very strong bond. And the lesser known thing is that Dr. Freud had written down notes and observations about how he felt in the presence of Jofi, and how it could be beneficial for certain people who had inhibitions in opening up to a therapist. So this wasn't really published with his the other well-known work. Many years later, in 1960s, Dr. Boris Levinson, who was a child psychiatrist, in his retirement days, had his dog Jingles in his clinic. And he observed that particular cases that he found difficult, where the children were not able to open up to him, or were non-communicative, or showed a lack of interest in engaging in therapy, opened up to Jingles, and in the presence of Jingles. So Jingles was not technically a part of therapy. He would just hang around in the office. But he saw that when children came in, they first gravitated towards the dog. And that's where he started having conversations and found out that his ability to reach out to his clients in the presence of Jingle was much more than in the clinical setup where it was just him and the child. And he was the first one to present a paper at the American Psychiatric Association on animals as co-therapist. And as all new ideas presented, he was laughed at and ridiculed, because giving animals the status of being a co-therapist was an idea which was unthinkable at that point of time. It was much later when Sigmund Freud's observations and his notes and his paper on his observations of how animals could be beneficial in therapy were published. That's when people went back to the paper by Dr. Boris Levinson. And about 10 years after that was when actual research started happening in how animals could be a part or structurally, scientifically, a part of counseling and therapies. So here we are presenting it in from the angle of animal-assisted therapy and counseling. But to look at it as a broader field, animal-assisted intervention, as the right term is known, comes under the larger subject of anthrozoology, which is the study of human-animal relationship and the mutual benefits. Now, there are many others well-known fields which come under anthrozoology, like human-animal conflict, or veterinary sciences, or animal behavior. All of these are a part of anthrozoology as a field. But what we are studying under animal-assisted intervention is the mutual benefits of the human-animal relationship. And from that, one branch is animal-assisted intervention. Now, why animals? Aren't humans, you're training, you're spending so many years doing your basic graduation, post-graduation, specialization In spite of that, we feel the need to have animals. So, one thing that I think most of you here have experienced is that at some point of time in your life, you've had an experience with a pet which you cannot overlook, right? Whether you have pets at home or not, whether it was an encounter with a street cat or a street dog or a squirrel that came to your window, as humans, we naturally gravitate towards animals. And that is our key wiring. Okay, that is essential for our survival. And that is what makes animals more appealing to us. Now, if there was a group of humans with animals, like if I was here on stage with a dog, you would have enjoyed the presentation much more than me just talking and showing you slides. That is a natural effect of having a live animal in the room. Now, compared to play therapy, where also you can have like a soft toy dog, but that dog is not going to be animated. That dog is not going to reciprocate to your emotions and your lifetime actions. That is what animals do. And when we combine this with the therapeutic approach and the scientific approach, the benefit that a pet gives to a family or to any person at home, the same benefit multiplied by the counselor's skills can be given to your client. So what is it that animals bring in? Now, in your presentation, you mentioned a lot of things about unconditional acceptance, about creating the atmosphere where the client feels that he has that space to share, positive regards. These are all the things that we learn as young psychologists. But we have to spend a lot of time developing those skills. And yes, we have a lot of skilled counselors who can do that. But with animals, it comes naturally. It absolutely comes naturally. I have seen my therapy dogs go to schools with children with severe physical disabilities, or palliative care centers where patients are there with open wounds, and many other situations. But the approach or the joy that an animal will show meeting that person is going to be the same irrespective of what disability, what age, what race, what color. Nothing matters to animals. And this part comes very naturally to animals. And when we have therapy animals, trained therapy animals in the clinical setup, we create that environment where the human or where your client feels completely comfortable and approachable. Not just talking to you, but through interaction with animals, will be more likely to connect with you as a therapist. And there are many theories behind why animals work in therapy, or what is it in humans that makes us gravitate. One is theory of biophilia. If you've heard of that, it means that we are innately connected or wired to interacting with animals. So not just animals, nature. So again, what you pointed out was that when we go out in nature, we feel more energetic, we feel more open, we feel more receptive to new ideas and new thoughts. But we forget one fact, that humans, animals and nature, these are not three different components. It is one component, nature, in which we have humans and animals. So this innate wiring, or technologically, everyone would know the term factory setting, like you have on your phone or your laptop. Factory setting is the default setting. So similarly, our default setting goes back to nature. That's why whatever we do, we will definitely come back to nature in some or the other way. So having an animal in the counseling or the therapy session is a very natural thing, which will go along with the scientific way of practicing therapy. And the second part is that animals create a social group, which feels safe for a lot of patients that you would interact with, or clients who would find it difficult otherwise to interact with human social groups. For example, Dr. Mahamuni here said that, in correction facilities or in prison centers, where they lack social skills, they lack empathy, making them work along with therapy animals can give them a safe space as well as an objective and a way to explore empathy within themselves. okay, which is much safer than replicating the same thing with humans, which they might be resistant to, because that resistance comes as a part of their issues. Similarly, with children with autism, I work extensively with children with autism and developmental disabilities. And I have seen, and I also have a study based on that children who find it difficult to maintain social contact, eye contact, communication, connecting with the therapist or the people in the room, they will have their focus on the dog. They will keep following the dog. So clinically, when there is a case description that this child lacks eye contact or cannot sustain attention, and in the first session I see that the child is constantly observing the dog and how the dog is moving and is able to sustain that attention there, that itself changes the entire equation, right? That's because the animal is a very safe social replica of what would happen in a human-to-human situation. And once the child feels comfortable doing that, then transferring that effect to humans becomes easier for us as therapists. So again, it is not just the animal. I'll be explaining that further. When I say, okay, we have therapy dogs working with children with autism or cancer patients or, in correction facility, it is not that just getting the animal and making the people or clients play with the animal is equals to therapy. It is definitely human and animal working with their skill sets together is what will create this effect. So to sum it up, animals are unconditional. We have all experienced that at some or the other point. Even though some may argue that no, they will expect treats in return, right? They expect something in return. But no, that is just, any form of transaction like that would happen between humans. And when I show you the videos, you will see that when we work with these therapy animals, there are no treats involved. The willingness of the animal is very important. The animal wants to be the part of therapy and understand what is going on and responds to it real time. So the animal is not going to wait for me to give a command. It's not like sit down, stay, not that kind of obedience. Obedience is not required, in fact. Here I want the animal to operate on his own, make his own decision based on what the client is feeling. So that is where the animal becomes a very unique tool in counseling. So again, pet parents, non-pet parents would have experienced that animals understand our emotions. They can sense our emotions, and not just fear, any emotion. Even before you experience it, like before you start crying, there will be a lot of changes happening in your body. Your pet or the animal around you will be able to recognize that. And we as humans do not have the senses or the sensory tools required to understand that with humans around it. We rely on facial expression, body language, and obvious verbal speech, right? But animals can sense the biochemical changes happening in us. And when that happens in a counseling setup, where I observe the dog responding to a client and the shifts that happen within the client, I get extra information about the client, which I can then redirect or mirror it back to the client. So there are ways in which the animal can reach out to the human that we as humans cannot. That's where again animals become that unique addition to our counseling setup. And giving scope for sensory stimulation, whether it is a dog or a cat or a horse or a rabbit. There are a lot of therapists who are trained in sensory integration therapy. But in sensory integration therapy, there are actual different objects that are given. How about combining all of that into a living animal who is going to reciprocate, right? And then making your children, the children clients or grown-ups, just exploring the dog, the fur, the wet nose, the rough paws, the nails, the tail, which is sometimes feathery, sometimes very stiff. So all of this gives like a package of sensory inputs, which as therapists you can then utilize in your work. So again, there's a big list of pointers which I have cut short, But the last one is very important. Spontaneous expression and play. Now, in the client population that I work with, especially children with autism or even psychiatric patients in rehabilitation, what they lack is that spontaneity in expression, okay, and that spontaneous play. Play comes when you are in a natural state of equilibrium, and for that to happen, you need to feel safe, and that is what the animals bring in. Okay, so imagine for a person to be in long-term hospitalization care, right? Play is not going to come in that person's mind. But when I get a therapy dog to that scene, and when the dog interacts with them, or even bedridden patients can throw a ball to a dog and the dog catches it, it brings in that element of natural spontaneous expression and play, which is like in a lot of cases, medicines will work to a certain extent, but the inner joy, if we can increase that, okay, as we call it, the quality of life, that a person can be bedridden, he can be in palliative care, or he can be in prison, but what we can improve through animals is the quality of life, right? So that is what we can do, bring in that spontaneity, joy, and play by incorporating animals. So animal-assisted intervention is the correct term to define the work that we do. You might have heard of other terms like pet therapy, dog therapy, canine therapy, animal therapy, but all these terms are very ill describing the work that is done. Because when you say animal therapy, or if you say this to someone who has no clue about what animal therapy is, it is very confusing whether the therapy is for the animal or for the human. Because 20 years back when I started working in this field, I used to actually get these kind of questions. Like, you're a human psychologist, but then why are you giving therapy to dogs? So this is a common confusion that happens. So we have a global organization called IHIO, which is International Association of Human-Animal Interaction Organizations, which is a conglomeration of all organizations across the world working in the human-animal studies sector. So they have come up with standard terms and definitions of how to address this field. So animal-assisted intervention is where trained therapy animals are a part of any form of intervention. Now, counseling becomes one form of intervention. What about play therapy? What about speech therapy? What about education? What about medical intervention? These are all forms of intervention. So just calling it animal-assisted therapy becomes very limited. But animal-assisted intervention is the broad term that will actually collectively talk about all the applications of animals in therapy. So, like I was saying, animal-assisted intervention will include animal-assisted counseling or physiotherapy or play therapy, and speech therapy, animal-assisted education, and animal-assisted activities. Now, I'll go back to the slide. Now, here we are, today's seminar is focused on animal-assisted counseling. So, here, the first thing I would like to clarify or give a background on is who can be an animal therapist, okay, and how can we say that, okay, an ex-person is doing animal-assisted counseling. Now, for any doctor who is a specialist, the person will have to be a doctor first. Similarly, for anyone to say that, okay, they are practicing animal therapy or conducting an animal therapy program, they need to be a therapist first. And that therapist can be a psychotherapist or a speech therapist or a physiotherapist, any practitioner, any professional working in the mental or the medical health field. So medical health field would also mean nurses, doctors, dentists. We are currently working with a couple of dentists who are incorporating therapy dogs in their practice. So it is not just counselors who can be animal therapists. Okay, but to be an animal therapist, you have to be practicing in some or the other form of therapy first. Then, working with a trained dog in your own premise of work will constitute to animal-assisted therapy in that format. So, I work in the counseling setup, and I'm trained specifically in animal-assisted counseling. So when I incorporate animals in my practice, it's animal-assisted counseling. Similarly, if a physiotherapist decides to incorporate an animal in his practice, it will be called as animal-assisted physiotherapy, and so on. And the application to this is not limited to just the clinical setup. We've had dogs in schools under the animal assisted education program. We take dogs to corporate offices where we work on work stress or the corporate life stress or the well-being of employees, as nowadays it is termed. We've also had dogs on the airport and palliative care centers and with heart patients. So there is no limit to where this can be applied, provided there is the right therapist working with you. Right? And another application that we have is the farm-based animal-assisted intervention. So we had Dr. Bakshi talk about the connect with nature, and I was going to talk, somebody had a question of what is the real-time applicability of this concept of having therapy or counseling in the natural setup. So in India, we have created certain places where the setup is very natural. So it's either on a farm or with a kennel setup. And abroad, if you look at Green Chimneys, which is in New York, it is one of the largest organizations which has farm-based animal-assisted intervention. And they have all animals from horses to sheep to cows to llamas and camels and all the other smaller animals also. But this is not a farm. This is not a zoo. They have a school and a rehabilitation for young children, young to adolescent children and teens who stay there on the farm. It's a residential facility, so the therapists work with these children, and these children get to work on the farm with the animals. Now, how have they managed to blend in these two things? For example, if a child is given a task, or rather I would go case study wise. So if there is a child who has conduct disorder or there is defiance that the child is showing, and he's given a task to go and feed the horses or groom the horses, if just the therapist had to work with the child on correcting his behavior or modifying his behavior, there might be a lot of resistance from the child. There might be a lot of clashes. It might take a long time for the therapist. I'm not saying that the therapist will not be successful. But the same thing, if given as a task to go and groom the dog, and if the child goes with, that kind of defiant energy and, marches towards the horse and demands the horse to respond to him, the horse is not going to respond. The horse will move away further. And this behavior reflection gives that feedback to the child that if I have to do something with the horse, I have to first modify my own behavior. The same thing that we do as therapists, the animal can do that with mere body language interaction. And again, this has to be guided by the therapist. So the child has to be told that, okay, if you want to go closer to the horse, there's a way to approach him. Let him approach you. You have to change your tone of voice, how you speak to the horse, how you touch the horse. And when the child sees that, okay, by doing all of this, the horse is actually responding to me, the elevation in self-esteem and the willingness to further participate in therapy and further work on behavior happens. And this will happen without even using the words behavior modification or any other term. So this is where animals, bring in that additional advantage. And in farm-based therapies, we go beyond the kind of city animals like dogs and cats. And there's a lot more option of animals that we can incorporate. For example, again, approaching rabbits. Have you ever tried to go near rabbits? Being natural prey animals, their first response is to scatter and run around. They're also burrowing animals. So if they have places where they can hide, they will first go and hide. But if you sit down and spend some time if it's a large enclosure, you will see that the rabbits will come to you. They will sniff you. They will jump on your lap. They will eat through your hand, eat from your hand. And This approach, when you modify your energy, when you sit down and when you allow them to come, you will see that the connect happens. And if this is guided by the therapist can very beautifully convey to the person that a small change that you can bring in yourself will help you connect with the animal and build that relationship with the animal. And that is very valuable when you're working with certain cases where reaching out to them, human to human, gets difficult. I have a different case study. I'll go on to the next slide. What do you think is it? I mean, I did talk about different animals, but dogs, cats, horses, rabbits, which other animals do you think can be a part of therapy? Dolphins, elephants. Okay, we'll talk about that. Rabbits, horses. Which other animals? Cows, turtles, fish, birds, mouse. Okay, we'll come to that. Anything else? Chimpanzees. We'll come to that. So my point is, where do we draw the line? We start from dogs, which are our, like, immediate next in the family, to cats, which, okay, some people may be like, why cats? Cats don't come to you and call. They will just like be snooty and walk away. But cats are excellent therapy animals, and I have a video about of my therapy cat at work. So yes, dogs, cats, horses, rabbits, fish, birds to a certain extent. I'll come to that. Hamsters, guinea pigs. Somebody said dolphins. Again, when we talk about ethics in animal therapy, that becomes a huge question mark, because the first and foremost principle is that the animal should be willingly a part of this work, and secondly, should be able to exhibit its natural behavior. So when you say dolphins firstly, if they are in the ocean, they are not going to come to you. They will come to you if you're swimming out in the open ocean, but not as a therapy animal, right? So when you put any animal out of its natural environment, you're basically prohibiting the animal from exhibiting his natural behavior, and that goes very much against the principles on which therapy animals work. So even with horses, I might take a dog to a hospital, but I will not harness a horse and take him to the hospital. Rather, I would have my clients go to a stable or a farm-based animal therapy center where they will observe the horse, or they will work with the horse in the natural environment. Same thing with the rabbits. Instead of having them in small cages, I would rather build a large enclosure, a walk-in enclosure, where the rabbits are in their natural setup with their burrows and with their hiding places and with the natural grass and mud, and humans are entering their habitat. So in this way, then all the other questions would be answered. So chimpanzees, definitely a no-no. Snakes, lizards, or any kind of animals where you will have to get them out of their natural habitat and natural behavior. And willingness. Will a chimpanzee willingly come to you and interact with you? Maybe if you go to the jungles, but not in a therapy setting. That's where you can answer all these questions. The welfare and ethics of working with animals is as important as the welfare and ethics of working with your clients that we are all taught as therapists. Yeah, this is a very beautiful quote that sums up a lot about what we try to explain about why animals work. Because I've been able to implement animal therapy in certain scenarios, for example, with post-trauma stress, or with children who are rescued from human trafficking, and other areas where requiring to tell the issue becomes a trauma itself, right? But you just take a therapy dog there, give the client time with the therapy dog, and you will see the first need is to just sit with the dog, or just hug the dog, or keep the head on the dog if the dog is lying down and sideways, and giving them that space and that time to connect with the dog non-verbally where the dog is not asking the case history of the client. That client doesn't need to share what he's feeling at that point of time. All of this happens non-verbally. Even the most non-verbal client, say a child with autism or any adult who is non-verbal, will be able to connect the dog at the same level without using any words or without describing what the case is about. So that is the advantage of having animals in your practice. Now, when it comes to areas of implementation, developmental disabilities, all forms of developmental disabilities is where animal therapy can be applied. Again, you can see here, there's a physiotherapist working with Kuti, the therapy dog, and the child. So, when we define therapy, animal-assisted therapy, the definition would be that it's a goal-oriented intervention where there is a therapist who is working with a trained therapy dog based on certain objectives. So here the therapist would be doing the same exercises with the child that he would do without a dog. But when paired with the dog at the end, the child gets a very clear objective. And not just an objective, but a reciprocation. Like if the child is made to do some extension exercises, okay, where he has to reach out or extend his arm or be able to grab, fine motor, gross motor skills. If he has to do those activities repeatedly in the physiotherapy setup, you will see most children keep crying during physiotherapy setups because it is painful for them and they don't understand why we have to push through this pain to be able to do it. But when the end result or the end objective is the dog, and instead of just reaching out or extending your arm, give the ball to the dog, and the dog is there to receive it. And not just there, but wagging his tail, wagging his tongue, and showing that excitement and giving that unconditional support. That is when you will see that the child is more willing to participate in therapy. And then the physiotherapist is there to guide and facilitate the activities. Right? And again, no matter whether it is children with disabilities in wheelchair, we have worked with children with paraplegia, we've worked with children with cerebral palsy, Down syndrome, hearing and speech impairment. So a lot of other developmental disabilities which can be benefited through animal therapy. So this is again a very interesting application. I'm very happy that schools have now started coming up to us saying that yes, we want a therapy dog for the school. And 20 years back, I had to go and convince schools and organizations on one side that this is going to be beneficial for your children, for your center. And on the other hand, I also had to go and convince the pet parents that no, your dog has potential to be a therapy dog. So my work was from both ends. But now there are schools like Inventure Academy in Bangalore, for whom we have trained 4 therapy dogs, 2 in the counseling setup and 2 in the primary education setup. We have Atman Academy in Mumbai, where we have therapy dog Rio as an in-house therapy dog. And we have American School of Bombay, where we have an indie dog, like a proper indie dog, who is now a therapy dog, working very closely with the different therapies that happen in the school. So there are a lot more schools that are now aware of the importance of having an animal, a therapy dog, in the school. Now, what is the therapy dog going to do? There's not just one avenue where the therapy dog can work. It can be anything from a structured academic lesson to more soft social skills like developing empathy, working on bullying, or in the counseling setup where the school counselor can work with the therapy dog, or on reading and other, the building blocks of academics. There are a lot of children who struggle to read, and there are a lot of children who have learning disabilities. Again, paired with therapy animals, you will see that their willingness to work on those issues with limited inhibition, right? You will see better results academically and behaviorally. Yes, again, animal-assisted intervention can be applied for cancer patients, for palliative care centers, or for those who are immunocompromised also as well. Now, one question that we get asked is, what about the infection? Like when we take dogs to hospitals, the first thing you will see is the guards or the administrators stopping us, no dogs allowed. Just recently, we were called at Pune University. And there also, we were called for a presentation, but the guards stopped us saying कि यहाँ पे dogs allowed ही नहीं है. So this is something that we had to encounter no matter whether it was a school or a hospital or a university. So this concept of dogs being dirty, dogs being unhygienic, or dogs bringing in infection is a very common mindset with a lot of people at large. But when we work with dogs in special settings, there is a protocol that is being followed. So our Indian government doesn't really give those health protocols, but NIH, National Institute of Health, USA, they have a protocol of infection control when therapy animals enter any kind of medical premises. And we follow the same protocols. So there is a way in which the animal is introduced in a hospital setup or any special care setup. And believe me, when done in the correct way, in fact, there is absolutely minimalistic, I wouldn't say no chance, because zoonotic diseases is something that is taken very, very seriously when we work with animals. But when done it in the proper way, the chances of transfers of infection and disease from humans to animals can be minimized. So we have had the opportunity to implement animal therapy in hospitals in different setups, not just with the medical setup, but in hospitals like KEM Hospital, Pune, where they have an integrated child guidance center. That is where animal therapy was introduced as one of the therapies, where children were referred from the physiotherapist, speech therapist, and the counselors. And then we worked together as a team. And that was the first time a therapy dog program was initiated by a hospital in the hospital premises. So that was like a big jump in acceptance of animal therapy as one of the primary therapies or mainstream therapies. So this is Scotty. Scotty was also one of my oldest working therapy partner. We lost a lot of our senior therapy dogs, since you know that the lifespan of the dogs is about 10 years on an average. All these therapy dogs, Goldie that I showed you, Kutti, Scotty, they are from our very early batch when I started in 2003. And in the last couple of years, we lost a lot of our senior dogs. But we have new teams coming up, and that's the best part of it, that now parents are aware, pet parents are aware. They will specifically pick up a pup and come to us saying that we want to train our pet to be a therapy dog. And that's a huge mind shift from going home to home convincing parents that your dog has potential, or being stopped at the gate saying no dogs allowed here, to now, places like airports or hospitals calling us for a animal therapy program implementation. So we had opportunities to implement or at least demonstrate the effect of animal therapy after certain situations, after the 2611 attacks or the 7/11 train attacks. So there, it was again, it was a small opportunity that we got to present, but the impact was quite lasting, because especially after the 7/11 train blast or the 26/11 attacks, a lot of nuclear families lost one of the family members, and then it was just a child and one parent. And then getting a pet or a therapy animal in that situation helped them in coping up with that post-traumatic stress much better than the other ways of coping with stress. So again, this is an area which needs to be explored further, especially in the Indian setup. Abroad, you will see a lot of PTSD dogs, which also fall under the service dog category. Now, service dogs are very different from therapy dogs. There will be, I can have like one session on that only. But one thing to know is that therapy dogs are pets. Service dogs are not pets. They are employed for a person with disability. And you cannot pet a service dog without the permission, or rather you shouldn't even ask for permission, because the dog is on job, right? So this is the primary difference. If somebody says that, okay, guide dogs for blinds can also be therapy dogs. So that is very different. Therapy dogs are pets who reach out to a larger number of people who are trained to give that emotional support to a wider community, whereas service dogs are trained to give that support specifically to the needs of that person with disability 24/7. So the dog doesn't have any off time or off days, right? This is one of the areas where I wish I can have more programs and more research work done. But having animals in certain geriatric care setups has a valuable advantage over other, not over other therapies, along with other therapies, I would say. Because again, what the therapy dogs bring in here is the need for socialization, the motivation to get up and move, the spontaneity in activities and interaction, which most of the geriatric population, especially in institution-based setups, lack. And it is very challenging to bring that about in them as compared to working with younger population. So this is a very good implementation, but we need a lot more programs and a lot more research happening in this area. And as Mahamuni sir also mentioned, that if a particular case can be reformed at a certain age, that is, we have correction facilities, juvenile delinquent centers, and if at that stage we are able to impact those children and bring about certain behavioral changes in them or attitude changes in them, then that can definitely help us stop more adults with criminal behavior or adults with adults who can be in conflict with law. So we were able to do this at David Sassoon Juvenile Delinquent Center with therapy dog Goldie and Coco. And though we had limited number of sessions that we could do at that center, we have qualitative data. We couldn't quantify the data. But what we saw was that the first thing that we realized as therapists is that when we took the dogs to the children and told the children, okay, now, what would you like to do with the dog? They were clueless. They didn't know what to do. They were like, "Aap batao na kya karna hai?" But we kept on telling them, "Aapko kya lagta hai? I mean, what do you want to do? What do you feel like doing?" Because the way in which we work is a very non-directional, child-centered way of working. So instead of telling कि अभी अच्छा ball फेंको फिर ball खेलेगा, instead of doing that, we wanted the children to take the lead, because that is a way in which they will connect with the dog and they will express or project their needs onto the dog. But for the longest time, they were not able to figure out that this is for us. We can do whatever we want, because the other people in the institute or other people around them had labeled them as juvenile delinquents. And the dog didn't see them that way. The dog only saw them as children. And for the children to realize that we are accepted the way we are. And once they formed that bond with Coco, our days were on weekends, and that's where their families could also visit. So they would literally choose to spend time with Coco, then to go and meet their families. That was the level of bonding that happened over a very short period of time. We hardly got 3 months to work with the children. But if this is the kind of impact that the therapy dog is going to have with the children, and if as behavior therapists and as counselors we can work along with the therapy dogs on specific objectives, then just imagine what kind of programs we can have at juvenile delinquent centers with therapy dogs. And if we can reduce the percentage of juveniles turning into adult convicts by even a small percentage, I think it's a big win. And that's where I approached Dr. Mahamuni to initiate something where we can do quantifiable research and have replications of these programs around our country. And is this something that you've heard of? Have you heard of the comfort dogs at Mumbai International Airport? Did anyone of you have a chance to meet these dogs at the airport? No? So from 2000 2013 to 2017, 2015 to 2017 is when we ran this program at Mumbai International Airport, the Departure Lounge, International Departure Lounge. And the surprising thing was the airport came to us with the concept. That again was a big step in the field or in the growth of the field. So Comfort Dog is an application of therapy dogs in a non-clinical setup. So when they are working with us as counselors or with therapists, we can call it animal assisted therapy and we can call the dog as therapy dogs. But on an airport, we were not running a therapy program. The objective was to have the dogs to comfort passengers who were flying out. Now some would say, wahan pe kya hai stress? People are flying abroad, right? On one of the most lavish international airports, which is the Mumbai International Airport. But believe me, just reaching the airport in time and crossing immigration and security check itself is stressful, right? On top of that, cancelled flights, delayed flights, long layovers, single travelers. A lot of people traveled with a lot of emotional baggage, which surfaces up when you have nothing to do. You will just kind of shop to a certain extent. You will read books. But when you have 10 hours of layover and just stranded at the airport, all your issues start surfacing up. And it was an eye-opener for us also, that all these, and given an opportunity, people wanted to spend time with the dogs than do anything else on the airport. And that's when we realized that no matter what it is, where there are humans, therapy dogs will have some or the other role to play in their life. So this was a wonderful application that we got to do. We also work with corporates. We take our Comfort Dogs to offices. That is a very upcoming field where managing the wellness of employees is now on the target, especially after 2 years of pandemic. Getting people to work from office is a big challenge for companies. Getting them to stay in offices is also a big challenge. And people have realized that work is stressful because they got to work from home for 2 years. So now they know that work is stressful. So companies are approaching us saying that we need wellness programs for our employees. And then we get therapy dogs and engage with the employees to give them that wellness. Now, these were all implementations. But being from the mindset of having empirical research to support what we are saying, the focus of our organization is largely on research work. And though we have not been able to do great researches or research of good magnitude with large subject numbers, we were able to document at least the work that we are doing and present it at international conferences and national conferences, which kind of gives that backing that what the work we are doing has scientific base and it's not randomly bringing in a dog in the therapy setting. So one of the recent studies that we did was with D.Y. Patil University and Dental College. This is where therapy dogs were a part of the pediatric dental setup, and we had 2 groups of children who needed non-invasive dental procedures. Now, I'm sure all of you must have had at least one visit in your life to the dentist, and it must have been extremely scary, or you must have been very, very anxious. If you have one visit scheduled in the coming weeks, that anxiety is going to surface. Imagine that with children. If you have children who need to be taken to the dentist, you would know what is the amount of preparation that you need to put in. The dentist you find a pediatric dentist needs to be skilled enough to be able to talk to the child so that the anxiety is minimum. But in a lot of children, dental anxiety, which is an actual term in dentistry, is when children have a lot of physical reaction to dental stress, which includes crying, which includes a stiff body posture, which will include actual complete avoidance, like getting up from the chair and running away, and so on and so forth. So we did a study where the therapy dog was present with one group during and after the intervention. And with the other group, it was the standard procedure. And we recorded their pulse, their we recorded the pulse, and there was a brief anxiety rating scale which the children had to fill. And we found out that, of course, before entering the dentist clinic, anxiety was high for both the groups. During the procedure, the group that had the therapy dog, and I'll show the photo. Okay, the photo is not visible. Yeah, so the therapy dog was sitting on the lap of the pediatric patient while the dentist was working. Now here you can see that, the child is able to reach out to the dog. The handler is there with the dog, constantly working with the therapy dog and in control. And the intervention specialist, which is the dentist in this case, is working with the client. And in this scenario, what we saw, that children were more willing to stay there with calmness and not like visible anxiety, and go through the procedure without the dentist being scared of hurting the child, because the child kept moving due to anxiety. And what we also saw was that, of course, the group which had the dog had lesser anxiety during intervention, but the interesting part came in the post intervention stage, where the group which didn't have the therapy dog still showed high anxiety and high pulse. Whereas the dog which had the group which had the therapy dog, after session, you saw that their anxiety lowered considerably, right? A lot of dentists will have these fish tanks in their clinics. Whether it's small or large, doesn't matter. But what happens is that people don't know what to do with the fish tank, rather than just looking at it for 5 minutes. We incorporate fish tanks in fish in general, like in tanks or in open ponds, in therapy. But there has to be an engagement with that, a guided engagement, right? If I had an animal with me here, whether it was a fish or a dog or a cat, I would have done this exercise with you, where I would have shown you how easy it is to attain the state of thoughtlessness, or how to work on mindfulness just with the presence of an animal, whether it's a fish or a dog. So this was another study that was done at Prasanna Autism Center, which is in Pune. Even there, we had therapy dog Sophie, who was the in-house therapy dog. Now, there's a difference, like we have the facility counselor or a in-house counselor in a particular institute, and then you have visiting counselors or visiting faculty. Similarly, we have in-house therapy dogs, who are dogs who probably live in the school premises or the institute premises, or with someone who is from the institute. And then we have visiting therapy dogs who belong to families and who visit on the given schedule along with our therapist. So Sophie was one of the in-house therapy dogs. She lived with the family that ran the autism center, and that was a study that we did, where we found out, the data showed that there was improvement in eye contact, in social communication, in facial expression, spontaneous expression, and fine motor, gross motor skills also. And autism is again one of the area where the implementation and the study behind it is largely done across the globe. This I'll go through very briefly, because some of the benefits are very obvious, but the key things that I want to point out is oxytocin. Have you heard of this term? Right? And in relation to pet therapy, a lot of articles are now also mentioning that, boost your dose of oxytocin by interacting with animals. But it's not that straightforward. Like, oxytocin definitely is generated when we interact with animals, but there is a science behind that, and how it helps in lowering our anxiety levels is something that is backed with research. So it is not randomly that we say that it's like shopping therapy to boost your mood. This is backed by scientific data. And other physiological benefits that you will see, that it not reduces blood pressure as so much as normalizes, or also it doesn't happen with just one interaction. You have to do it over a period of time. So there again has been a study which showed that people who were recovering from stroke or heart operation recovered faster in the companionship, or if they had a pet at home or were working with a pet, they recovered faster than those who were only taking rehabilitation sessions post-operation. So this talks a lot about, what your pet at home can do. Even though the pet is not a therapy dog, the pet at your home can give you a lot of physiological and psychological benefits. So when combined with the right therapist, you will see that different benefits under cognitive, psychological, emotional, social, educational goals can be attained. Now, I'm sure a lot of therapists over here would be thinking of, okay, how can I get trained? What is the certification? Okay, which colleges offer that? So the question is, who can be an animal therapist? Now, before, when I said that anyone who from the mental or medical health profession who is practicing in the professional capacity can then further get trained to be animal therapist. So you need to have a postgraduate degree plus your professional. Now we have very limited licensing as per se compared to other countries. But what is required for you to practice in your field, that plus the advanced course of animal assisted intervention is what will make you an animal therapist, right? The course that I offer, level 1 is open for all, because this field being new, whether it's a pet parent or a student from any other background or any other profession wanting to learn more about animal therapy can do the level 1 course, and postgraduate and practicing professionals get to do the level 2 course, which is combined with internship and field training. Because animal therapy is not something that you can just learn from presentations and books. It is a very hands-on training, because you're not just learning about your skills as a counselor, but you're also, you have to learn about the animal's behavior, the animal's stress responses to a particular situation, and how will you combine your skill or your mode of therapy with the animal. For example, if you're practicing play therapy, how will you incorporate animals in play therapy? What are the activities that you will plan around the animal which will be congruent to the play therapy format? Similarly, if you're doing art-based therapy, or if you're doing CBT along with animal therapy, how would that look like? What activities you will plan around the animal? Because animal therapy goes beyond petting the dog and playing with the dog. As you know, it's a general assumption that when you play with the dog, you will feel better. Of course, you will feel better. But for therapy to happen, or for intervention to happen, it has to be structured, and the animal has to do more than just be there. So if I'm able to show you the videos, you will see that there are no treats in our hands. There is no leash. The animal is operating on his own, responding to what the client is doing, and not waiting for my command or the handler's command to work further. Then what do we do as therapists? If I'm not controlling the dog, again, like we have client-centered, we also have this as dog-centered or dog-led therapy. So here I become the facilitator. So I will just facilitate interaction between the client and the dog, and see to it that I bring out the best in both. I have to look at the client and his responses, his needs, as well as I have to look at the dog or the cat and his responses and his needs. If a child is putting a lot of pressure and trying to cuddle the dog, and the dog is trying to wriggle out, instead of just, don't do that, how will I redirect that activity so that the dog is also comfortable, and the child, if the child has sensory needs or the need to hug, how will I still maintain that? So this is the complex part of, putting animals and humans together, which for a therapist will have to, they'll have to learn it on the field by observing a lot of sessions, by working with different animals, because just like humans, animals have different personalities. And how to incorporate those personality traits in therapy, again, becomes one of the learning aspects. Then there is another category for training, which is the animal handler. Now, to be an animal therapist, you need to be a therapist first. But to be an animal handler, you can be someone who likes animals or who has knowledge in handling animals or working with animals. right? Now, this is the training which, again, is very essential, because in a lot of places where we work with, especially with children with disabilities or where we visit in hospitals, there is always a therapist, a therapy dog, and a therapy dog handler. So where the therapist can completely focus on the client's need, whereas the handler can focus on the dog's need, right? So the role of a therapy dog is also something that those who are not from the mental health or medical health background can explore and still be a part of this field. But training and certification is required. So Pet Partners is one of the largest organizations worldwide which certifies and trains dogs for to be therapy dogs. And it is not just the dog, but the dog and the handler as a team which is evaluated and certified. And I am the international evaluator for India, where one part of the course is online, which you have to complete. And the second part is the practical evaluation, where I evaluate the handler and the dog together. Besides that, we have Therapy Dogs India training, which is like Pet Partners is just one exam. But Therapy Dogs India program is like a complete hand-holding. Say, for example, you and your dog both need to get trained in this work. Then you do the Therapy Dogs India certification. And who can be a therapy animal? So just like we have certification for therapist, the animal also needs certain qualities, personality traits, temperament, and willingness to work. It is not the pet parent which will decide whether the dog gets to be a therapy dog or not. It is not I who will decide whether, the evaluator deciding that whether the therapy dog can be a therapy dog or not. It is the dog or the cat or the horse or whichever animal is participating in therapy, willingly enjoying the work and wanting to be a part of the program is what will define whether they can be a therapy dog or not. So that willingness comes first, then their behavior traits. So not all friendly and well-behaved dogs can be therapy dogs. Why? Because dogs can be friendly and well-behaved. They can be very good on obedience. But are they able to respond to the human in front of them? Are they interested in staying connected and responding to the human? If not, then just training and being friendly is very limited. So we need dogs who are proactive, right? And their confidence level, just like, to be able to come on stage and speak, or to be a lawyer or to be a doctor, you need certain personality traits and you need an optimum level of confidence to be able to do that job. With therapy dogs also, you will see that these dogs have the confidence. So if I were to get a dog here, unfortunately we don't have teams in Goa, and I'm looking forward to having more therapy dog teams in Goa. But if I were to have a therapy dog walk in this kind of a scenario, where this setting is new for them, all the people are new for them, there are camera stands, there is loud, the mic is there, and if anything falls down or if somebody walks up and in that narrow passage there is a lot of crowding, even then you will see that the therapy dog will be maintaining his temperament and his composure, and will confidently walk till here and interact with everyone. So this quality is not something that every dog has. This is where evaluation is important. And the risk of working with non-evaluated dogs, like a lot of people will say that, okay, I can train dogs, so I'll train my dog to be a therapy dog. Great, you can always train your dog to be a therapy dog, but there has to be an external evaluation and standardized certification, because that means that the dog has undergone the training and evaluation which is standardized for all dogs, right? Just like we have our clinical certifications or licensing. And the risk for that, the first thing that comes to your mind is, the dog jumping or biting or scratching the human. That is just one aspect of it. There are a lot of dogs who will just silently suffer, because dogs are primarily compliant. Because the owner is saying to be here and sustain the interaction, they will do that. But the dog will end up getting a lot of under a lot of stress, and that is not something that you want. Equally as you don't want the dog to bite anyone. So from both ends, we have to see that the dog is enjoying the work. That's why working with non-trained therapy dogs is a complete no-no if this field has to be sustained further. Yeah, and safe and meaningful interaction is the primary objective of behind involving animals in therapy. So we have Pet Partners, Animal Angels, and Therapy Dogs India, the three organizations that provide training and certification for pets, for therapists and for handlers. Yes, we covered this. And most importantly, we do not use animals in therapy. They are our co-therapists, so we definitely respect their willingness and their their need to have the freedom to move about in a setting. So if you were ever to visit Pune, you're welcome to visit my center, where you will see that whether it's a cat, the cat is free to roam around in the room and sit wherever he wants, or for the dog, there is enough space for the dog to move around. So giving them their status of our co-therapists is very important, and giving them that space and that where they can exhibit their natural behavior becomes very, very important. Thank you so much.